Hi, I'm Dr. Scott Russo, Senior Medical Advisor to Nutrifuel Nutrition and Certified Unbeatable Mind Coach. I want to talk to you a little bit about a process that I have my patients do prior to surgery. We know that from a surgical procedure, it's a very stressful and trying time. And a patient needs to win in their mind before they enter the battlefield of surgery. And so I've come up with 5 key steps to doing this. These key steps are setting an intention for your experience. So pre-surgical preparation, how you're going to handle the hospital experience, and then once you leave the hospital, what are you going to do to maximize your recovery? That's setting the intention. We can't always control what happens to us in surgery, in the hospital, but we can control how we respond to it. And that's where preparing the mind comes in. The second of the 5 steps is mindfulness, or controlling our arousal state. And we do that through a process called box breathing. The third step is where we put our attention control. When we start to go negative, how do we stop that? And how do we go more to a positive state of mind? The fourth step is visualization. How do we visualize ourselves as a powerful, healthy, vibrant patient recovering from surgery, recovering from illness or injury? And then finally, goal setting. Smart P goals. What am I going to do the day my surgeon and I decide that surgery's the next step? How am I going to prepare for surgery over the ensuing weeks prior to engaging in the surgical process? Those 5 key steps are what will allow you to have an excellent clinical outcome. So let's talk about setting an intention. There are 3 key questions you need to ask yourself. The first question is, what do I value most about my health? Why do I want to get healthy? Why am I having this surgical procedure? So a very powerful why will support you in all the preparatory work you have to do. Fear, negativity will go away because you have a clear path to health success. What we might find as we decide that we're going to proceed with surgery, we're going to engage with physical therapy to condition our body. That's part of the prehab process. We're going to work with our behavioral coach to make sure that our mind is in the game. And all these other things about nutrition, diet, we might engage with a dietitian or a nutritionist to make sure that we're eating the healthiest foods, and of course, moving towards supplementation as a pre-surgical preparatory process. The second question is, what are my responsibilities for my health? What do I have to do from a physical standpoint? What do I have to do from a nutrition standpoint? What do I have to do to get all my medications in order, to get off tobacco, to cease using alcohol? Everything designed to make me the healthiest me prior to surgery. And then the third question is, who's going to support me along my path to recovery? So how am I going to engage my family? How am I going to communicate with my caregivers, with my family physician's office, with my surgeon's office, with the hospital? So having this all laid out and planned for before engaging with surgery, before you get to the hospital, is critical, up to preparing your go bag the night before. So the second part is arousal control. How do we control our internal state? I mean, the idea of having surgery is very anxiety producing. So we can use tips or techniques to calm our mind, to calm our body, to make sure that after surgery, when we feel the pain in whatever body part that's been operated on, we're able to breathe through it. We're able to focus on our breath, not on the pain. If our muscles spasm, we're able to breathe through it, relax our muscles, so that we move through the breath. So I'm going to teach you a simple technique called box breathing. And it's available in the monograph that's free on the website that I encourage all of you to get. But this is just an introductory video to help guide you along the process. And with box breathing, there's a box breathing app that I would encourage everybody to get. And you can set it. It's at the App Store, and it's very simple to use. So the box breathing app is a very seamless and easy app to follow. And you heard it now. This is breathing out. So I want you to get in a comfortable position, a chair, soften your gaze, and then we'll start. We'll breathe in next. In. Focusing on the breath, the air, hold it. And then out. And then hold. And then breathe in. And hold. And then out. And breathe in. Filling up your belly, letting all the air come into your body. Calming your body. And then out. Hold. Breathe in. Hold. And out. And hold. So that process is fairly straightforward, and I suggest that you begin with a 3-second count. So 3-second in, hold it for 3 seconds. So in, 2, 3, hold, 2, 3, out, 2, 3, hold, 2, 3. And you do that cycle, begin with 3 or 4 or 5 times, and do it several times during the day. But you can actually feel, as you take that deep breath in, you can feel your stress level go down, and you feel like you're in control of your mind. You start to witness your thoughts. As you witness your thoughts, you can then stop negative thinking, stop anxiety, but it takes practice. The third step in the preparing your mind for healing process is attention control. So what do you do when you're starting to feel negative? If this is occurring before you ever get to the hospital, you start to feel that anxiety inside, the pressure of surgery, of coordinating your care, you're concerned about the outcome. How do you stop that? How do you become aware of that? Well, what we're going to see then, as you're doing your box breathing, you're witnessing your thoughts, you're starting to engage and become aware of your thinking. When you start to feel a negative thought, you've now witnessed it. That witness is like the sentinel at the gate. He's your guard. He's guarding your emotional state. And so once you pick up a negative thought, then you have to do something to stop it. And I think in the book, I talk about the direct technique, but we can shorten it down a little bit. And if we use the acronym called WORM, the W stands for witness. The I stands for interdict, to stop that negative thought. The R is redirect, so you're putting your mind to a different area. And the M stands for maintaining it, using a powerful mantra to maintain your thoughts in a positive direction. When this happens and you use the WORM process, you witness your thoughts. And so when you anticipate that you're going negative, you're starting to lose ground, you say stop. After you stop that negative thought, you interdict by saying, I've got this. You say, David, I've got this. Easy day. Yeah, use your name. And then you redirect to a powerful mantra. So I am a strong, healthy person, and I will win over this battle I'm in. I will win over this cancer. I'll win over this surgery. I'll win over this infection. So whatever it takes. You maintain it with a mantra by saying, my health is in my control. No one can dominate me. My health is in my control. That's how you maintain it. The next technique is visualizing for health. And there are a lot of different processes or practices for visualization. But I think one that's really key is to find that quiet space, get in a comfortable chair, and then as you're in the chair, you close your eyes, you do your box breathing, and then you start to visualize yourself recovering from surgery. You actually see yourself coming out of the anesthetic, being awake and alert. When the nursing staff offer to help you, you work with them to get up and out of bed and to walk, to move, to engage. As you're doing that, you're breathing through the pain. Deep breath in, deep breath out. And as you get through the pain, you start to relax your body. You visualize yourself before you ever get to the hospital doing this. You visualize yourself coming out of the hospital, going home with your family and your health team around you. That's critical. So when we visualize for our health, a large part of our thinking begins as a picture. So we can take that picture in our mind's eye and make it come alive using our senses of sight, hearing, touch, taste, and smell. In essence, bringing our mind into the game, making it active. So let's talk about a specific example of how we can use visualization to prepare and recover from a surgical procedure. So let's say you've developed arthritis of the hip and your surgeon has suggested a hip replacement. Now you immediately feel anxious and your heart starts to race. You lose focus on the discussion you're having with your surgeon, and at that point, you fall back on your mindfulness training. You start to slow your breathing, you focus on the movement of air in and out of your lungs. And then after a few moments, you're ready to re-engage in a very focused manner the conversation with your surgeon. After you leave the doctor's office with your preoperative checklist, you head home to prepare. In preparation for surgery, you develop a daily routine around optimizing your health. Developing this routine gives you a sense of control, and that's critical, control over your condition. So what does your daily routine look like? Well, after a restful night's sleep, you begin by drinking a big, large glass of water, rehydrating your body and awakening your mind. You get out your journal and you jot down an expression of gratitude. It might look something like this. I am grateful for my physicians. I'm grateful for my family and the opportunity to improve my health. You complete a 5-minute box breath practice to reinforce your breath awareness and your witnessing process. After you finish your daily journaling by writing down the specific goals you need to complete in preparation for your upcoming surgery, you feel a sense of excitement, a newfound ownership over your health and wellness. You finish your daily journaling by writing out specific goals you need to complete in preparation for your upcoming surgery. You feel a sense of excitement and a newfound ownership over your health and wellness. Another example of a challenging health condition would be a new diagnosis of cancer. Meeting with your physician and hearing the diagnosis, you begin to hyperventilate. Your sight narrows and a million thoughts and concerns enter your mind. But using tactical breathing, 4 seconds in, 4 seconds out, this rhythmical breathing allows you to quiet the mental chatter and return to the conversation with your doctor. During the conversation, you ask clarifying questions to understand the situation better and your options moving forward. Returning home, you acknowledge the situation and plan to have a meeting with your family and your healthcare team. Prior to the meeting, you find a comfortable position and settle in for a 5-minute session of box breathing and mindfulness. Achieving a sense of calm, you're now ready to fully engage in developing a plan to manage your illness and to optimize your health. Using mindfulness and meditation daily, you support your body's immune system and bolster your psyche. You take time to journal daily, using gratitude and optimism to create your healing environment. Goal setting is the 5th and final step of the preparation process. Goal setting can be viewed as putting in place a series of steps or tactics to achieve a specific outcome or goal. Goal setting can be viewed as putting in place a series of steps or tactics to achieve a specific outcome or goal. The process should be well structured with the steps clearly written out. This is true of all goals an individual wishes to complete. A goal can be defined in many ways, but in essence, it's a desired outcome that may be achieved through effort. For example, Undergoing a successful total joint replacement without complications is my goal. Another might be, I just don't feel well. I'm committed to changing the way I fuel and condition my body with the goal of more energy and better mental clarity. There are two main types of goals. There are being goals and doing goals. For the purpose of our discussion, we'll focus primarily on the doing goals. How do we decide which goals to set? And how do we structure our goals to move in the direction of better health and wellness? Let's keep it simple and use a couple of common techniques for choosing and implementing the most important goals. First, you need to define what you're trying to accomplish. What is the main overarching goal you're striving to achieve? For instance, if you're scheduled to undergo a total hip replacement, in order to get ready for the upcoming surgery, you need to decide on the steps needed to prepare for the procedure. A major goal is optimizing your health through better nutrition and getting cleared by your family doctor in preparation for the surgical procedure. This can be viewed as a being goal. However, if you're overweight and in poor physical condition, how do you decide on what to tackle first? A technique well outlined by Mark Devine is the FITS approach. You ask yourself, and the F stands for, does the goal fit your current situation? Is it important to your recovery after surgery? That's the I. The T stands for, is the timing right? And then the S is simplicity. The KISS principle. Keep it simple, smarty. Optimizing in each of these areas is critical for your recovery after a major operative procedure. Breaking them down into two minor doing goals is an excellent way to handle these challenging areas. Devine's Smart P approach is excellent for clarifying and outlining each goal. The S stands for specific. The M stands for measurable. The A is achievable or attainable. The R is realistic and relevant. And the T stands for time-bound. And everything should be wrapped in a positivity, a statement of positivity. So using the Smart P technique, let's work through each of these goals. We talk about specific goals, and we're taking the scenario of obesity, knowing that you as a patient suffer from obesity and lack the fitness level critical for recovery, you start to prepare for your surgery. Having become proficient in mindfulness, you enter your mind gym and engage with your imaginary mentor. That mentor gives you insight, and so then you go online and purchase the Nutrifuel meal system. You get the meal system and the cookbook, and you start to engage with your dietitian or your coach in the way in which you want to lose weight. At the same time, you enlist support of your family and your friends to hold you accountable and to provide positive encouragement. You set a specific goal daily, monitoring your intake and limiting it to 1,800 very healthy calories. And prior to surgery, say a month prior to surgery, you implement the surgical supplement program to fill in the nutritional gaps. You also build your fitness by working with a physical therapist to condition your body. To build your fitness, you commit to another specific goal. You put in place an aerobic conditioning program to strengthen your heart and lungs. You also, because of the painful hip limits weight bearing, you sign up for a pool exercise program, making your commitment a reality. And in addition, you have an anaerobic program or a strength training program to prevent sarcopenia. You set measurable goals. If losing 10% of your body weight is critical to you, then you set that as a measurable goal. And you begin a daily recording in your life or your recovery journal of your weight loss and improved fitness capacity. So that's your attainable goal. Putting your accomplishments on paper and really feeling that improved sense of wellness makes the goal of being healthier achievable. And then you set it as realistic or relevant. You've set weight loss and exercise goals that are very realistic. Getting healthy prior to a surgical procedure is an obviously relevant effort that will improve your overall healing process, lessen your complications, shorten your time in the hospital. And time-bound, setting the surgical date defines the time frame for the preparatory process. It creates a sense of urgency and ownership. And then ultimately the P stands for positivity. As you continue to spend time visualizing your future self, as you create that sense of positive feeling to the process of setting and reaching goals, micro goals to major goals. So ultimately, you get in place to implement your plan. And I believe that you're stronger than you think you are. And if you're facing a battle, whether it's impending surgery or healing from illness or an injury, you now have the tools to attack that challenge and to win. By determining your desired outcome and visualizing your success, by becoming more tuned into your thinking and your breathing, you can set general and specific goals to help you get to where you want to be. Then it's just a matter of consistently and confidently following your plan. So let's get started. Good luck on your healing. Good luck on your recovery.